So here we are in September again, and once again, I'm looking forward to October, but at the same time, not wanting Pinktober. This is something that's bugged me for years and years and years, probably the worst when I had to buy pink socks for my son to play football. That kind of put me over the edge, saying, why am I putting this money towards something that is spending money on socks? So I'm trying to turn this around, and I want you guys to help me. This is a call to action for everybody because we have something new in Salina that we can actually do something different with now. So what I am encouraging is, instead of going pink in October, let's go green. I want to go green this year. And what green means is that let's become aware of breast health rather than breast cancer. I'm pretty sure everybody knows a lot about breast cancer. Who knows about breast health? Who knows about preventing cancer in the first place? This is where we can help. I have a new technology here in Salina at our office called thermography. So what is thermography? Let's take an example of, say there's a chance of severe weather, and here in Kansas, of course, we have that quite often. If there's a chance of severe weather, what do? Do you go out on your front porch and watch the skies? Now, I know some people do in Kansas, but is that the best thing to do? Go out and just look in the skies and see what's going to hit you right when it hits you. Or would you go and look at the radar? Because the radar is going to give you more information. The radar will give you a warning. The radar will allow you to decide, is it actually going to hit me or is it going to pass by? And that way you can be proactive and do something about it. You could shut your windows, make sure the pets are in, make sure everything is ready for a storm to come. So think about that the same as thermography. There is a reason to stand out on your porch. Sometimes it is pretty to look at the storms, and you will be able to see something that's already there, but you won't be able to see necessarily what's coming from too far. So with thermography, it's the same thing. Mammography is going to show you what is there. So if something's already there, the mammography will show that. Thermography is going to give you a warning. Thermography is going to show temperature changes, and temperature changes happen when cancer cells first start to divide. When they start to divide rapidly, they increase circulation, which creates heat, and that is what thermography checks for. So this is something that's non-invasive. Any age could do it. I could do that on a 2-year-old. I could do it on a 20-year-old. And by the way, who is getting mammographies? 40 years and older. Well, if you get breast cancer in your 20s and 30s, those are usually the very aggressive cancers. So this is another population I'm really trying to target, is these women who should be doing something to check, but they haven't had anything. Well, now you do. In Salina, Kansas, we are able to do this thermography, breast thermography, and actually full body thermography, which I'll be talking about more. But I want you to start getting in your head, and I want you to start thinking about it, and I want you to start learning about breast health and actually preventing and monitoring without ionizing radiation, without compression, without anybody even seeing you. You're on one side of the curtain, I'm on the other side. So nobody touches you, sees you, anything. It's the most amazing screening device for breast cancer. This is what we're going to do in October. This is what you guys are going to do to take care of yourselves and help you and your family members and all of your friends. So I want you to check out btiscan.com. So btiscan.com. This is a website that has information about the equipment that I have, lots of videos that you can watch, and lots of information about what I'm doing here at the Chiropractic Wellness Center. So stay tuned. I'll be doing more information here on the YouTube videos, and we'll talk about breast health and talk about prevention.